Hello everybody, in this video lecture we continue chapter 5, the integumentary system. So chapter 5 part 2. Function of the integumentary system. Your skin is three major types of barrier. The first barrier is a chemical barrier. pH of your skin is low and it prevents bacteria from growing on your skin and dividing and infecting you. It's a biological barrier because of dendritic cells and macrophages that are part of your immune system. It's also physical or mechanical barrier. You have keratin and glycolipids that block most of the water and water-soluble substances and prevent you from dehydration. You also have limited penetration of skin by lipid-soluble substances, some organic solvents, some heavy metals, and some drugs. Another function of the integumentary system is body temperature regulation. Actually, you losing quite amount of fluid from your skin. It's called perspiration, and it's evaporation from your body surface, about 500 milliliters per day. Also, when temperature elevates, your dermal vessels dilate. And by dilation, you bring more blood to your skin and you radiate excess heat from your body that prevent you from overheating. Another function of the integumentary system is cutaneous sensation. You have sensory neurons and sensory receptors that allow you to feel temperature, touch, and pain, also vibration and pressure. Your skin has metabolic functions. It synthesizes precursor for vitamin D, and vitamin D needed for calcium absorption. Your skin is also blood reservoir that store about 5% of your blood volume, and your skin gets rid of a small amount of nitrogenous waste and salt in sweat, and this is excretory function of the integumentary system. Skin cancer. Most skin tumors are benign, they don't metastasize. The risk factors include overexposure to UV radiation and frequent irritation of the skin. There is three major types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma is least malignant and most common. Squamous cell carcinoma is second most common, and melanoma is most dangerous but least common type of cancer. Basal cell carcinoma. Cells in your stratum basale, so it's the deepest layer of epidermis. They divide, proliferate, and slowly invade dermis and hypodermis. Prognosis is pretty good, 99% cured by surgical excision. Squamous cell carcinoma, second common type of skin cancer, involves keratinocytes in stratum spinosum. Most common on scalp, ears, lower lip, and hands. Also good prognosis if treated with radiation therapy and removed surgically. So you can see that cells that divide and form tumor are cells of the basal layer and cells of stratum spinosum, because cells in a more superficial layer, they are dead cells. Cells in a granulosum, lucidum, corneum, those cells are dead, so they cannot divide, and as a result, they cannot form tumors. The least common but most dangerous type of skin cancer is melanoma, and it involves melanocytes, highly metastatic and resistant to chemotherapy. So we use immunotherapy and, of course, excision, surgical excision to treat it. So here we have ABCDE rule to recognize melanoma on the skin. So A stands for asymmetry. The two sides of the pigmented area do not match. B stands for indentation, border indentations. C for color. It can be black, brown, tan, sometimes even blue. D for diameter. Diameter is larger than 6 millimeters. That is the size of a pencil eraser. And E for evolve. And that means that this pigmented area is changing over time. It's changing in color, in texture, or in size. Burns. Burns involve tissue damage, denature of protein, and cell death. And burns can be caused by heat, electricity, radiation, or certain chemicals. Immediate threat immediate threat is dehydration. So because our skin protects us from water loss, if skin is damaged, we can lose lots of fluids from our body, and we also have electrolyte imbalance. This will lead to renal shutdown and circulatory shock. Because we're losing fluids, the blood volume decreases and blood pressure drops. When your blood pressure drops, we call it circulatory shock. This specific shock is hypovolemic shock because of the low volume of blood. We use rule of nines to estimate the volume of fluid loss from burns. Adult patients who have burns that cover 15-25 or more of their body need fluid resuscitation. And we use what is called Parkland formula to calculate how much fluid patient needs. And we don't need to memorize the formula, but if you look over here, we take a certain amount of fluid, multiply by the weight of a patient, and then we multiply by what is called BSA. So it's a body surface area that was damaged by the burn. So here our body surface area calculation, and this is what is called a rule of nine, because your body kind of divided into segments, into parts, and each part is a 9% of your total body area or half of 9% or 4.5. So you can see anterior and posterior head and neck together will give you 9%. Your upper limbs and let's say anterior part of both upper limbs, both arms, total give you 9%. So here, right arm 4.5, left 4.5, and this is posterior view, again 4.5 and 4.5. So that's a 9%. Then the thoracic region is 9%, anterior part, posterior part is 9%, abdomen is 9%, posterior trunk is 9%. Now, low limbs are pretty big part of your body, so each one is 9%. So anterior part of the right low limb is 9%, right leg, and here's our left leg is 9%, and the same with posterior part, right? So rule of nine, again, kind of divide your body into parts that either equal 9% or give you total 9% when you add anterior and posterior part. And of course, we have perineum, that is 1% of the body. So here's your total 100%. So now when you calculate BSA, you can calculate how much fluid patient needs. So we have partial thickness burns, and it includes first degree and second degree. First degree includes only epidermal damage, and it's characterized by redness, edema or swelling, and pain. Second degree involves epidermis and upper dermal damage. This is where blisters are formed. So second degree, you will see blisters, and it will be a lot of pain as well. So on this picture, you can see both first degree burns on the fingers, and on the palm, you see the second degree burn. Full thickness burns include third degree burn, and third degree burn includes epidermis and dermis. So entire thickness of skin damaged. It's gray, white, cherry red, or black. No initial edema or pain. And there is no pain because damage is so deep that it's damaged or destroyed the nerve endings. No nerve endings, no pain impulses to your brain. So no pain. And this one will not regenerate, and it will require grafting. So burns are critical if they involve more than 25% of the body of second degree burns, more than 10% of third degree burns, and if we have third degree burns on face, hands, or feet. Now, developmental aspect of your skin. So epidermis originate from ectoderm, dermis and hypodermis from mesoderm. Lanugo coat is a covering of delicate hair in 5th and 6th months of development, and Vernix caseosa is a secretion of oil glands that protect skin of the fetus. You know, fetus is surrounded by fluid, and our skin is not very well adapted for this watery environment. That's why this oily secretion comes handy. So here you can see Lanugo coat and Vernix caseosa, and this baby is already born. So maybe this baby was born premature and it still has this Lanugo coat, but it will disappear in a couple weeks. And this like yellow substance covering this baby is Vernix caseosa, that is secretion of oil glands. Adolescent to adult, so sebaceous gland activity increases, and then we start to accumulate these environmental assaults that shows on our skin after age 30. Scaling, dermatitis became more common when we get older. At old age, epidermal replacement slows. Skin becomes thin, dry, and itchy. Subcutaneous fat and elasticity decrease, leading to cold intolerance and wrinkles. Also increased risk of cancer due to decrease of number of melanocytes and dendritic cells. And on our last slide, you can compare younger skin with the older skin. You can see in the dermis of younger skin, we have nice arrangement of the collagen and elastin, and then we're losing this nice pattern that leads to the wrinkles in a deep skin. And also, it's not seen here very well, but hypodermis became thinner, and actually epidermis might become even a little bit thicker. Okay, so that's it for this chapter. I also want to remind you guys that you don't need to watch these video lectures. You can just read your chapters or just read a regular PowerPoints that you can find on Canvas. This is just extra help, and I hope you learn a lot. So bye till next time.